my name is Dr. Venus Seleme, and I'm the owner of Seleme Chiropractic and Wellness Center in Fairfax, Virginia. Today I wanted to do a brief video on teaching anybody that's interested in strengthening their lower abdominal muscles. Basically, part of these muscles form what's called the core, on how to get them strong. And this would be anyone that perhaps childbirth has weakened your stomach muscles, perhaps just lack of activity has weakened your stomach muscles, and it's those lower abdominal muscles that are hard to kind of get at, even with traditional exercises meant to strengthen the abdominals. So a couple of exercises that I give to my patients, one is on the therapy ball. Everybody loves a therapy ball. You kind of get on it and you start feeling like a kid again. But one of the reasons that we use a therapy ball is to see if we can't take the abdominal muscles, which are what are considered strap muscles. So strap muscles are not going to bulk up. They're not like your quadricep muscles, and they're not like your bicep muscles, but they will tone up. And in order to completely get the full benefit of the abdominal exercises for the lower abs, what we need to do is take the abdominal muscles into full range of extension. And it's sort of hard to do that when you're on the floor. So one of the exercises that I give to my patients is to get on a therapy ball, and a lot of you have these at home. You can probably buy them at your local store, even in your chiropractor's office, or at the gym perhaps. And you're going to get on the ball, and you're going to just roll out. Let me just move back just a little bit so we have a little bit more space. Okay, you're going to get on the ball, and you're going to roll out. Remember, when you're on the therapy ball, you don't want anything sagging or anything loose. That's the great thing about the therapy ball, is it forces you to tighten your gluteus muscles, it forces you to tighten your thigh muscles, and it forces you to tighten your abdominal muscles. Because if you don't, you start wobbling all over the place. So what we're going to do is we're going to slowly walk our bodies out. You're going to keep your chin tucked. No chin jutting like this, because that strains the disc in the neck. You're going to walk your body out, tighten the glute muscles, tighten the thigh muscles, and you're going to suck the abdominal muscles all the way to the back of the spine, if you will. And you're going to do that not by breathing in like that. You're going to do it by literally feeling your belly button, taking those muscles and imagining you're pushing them straight back to the spine. And once you do that, if you feel strong enough, you can actually bring your arms up overhead, roll back, and then bring your arms this way, remembering to keep your chin tucked, remembering to keep the abdominal muscles tight with the belly button to the spine, and you're going to slowly walk yourself up. And that's considered one. You're going to go back again, very controlled movement, no chin jutting, no stomach poofing, belly button's going to be to the spine, and you're going to bring your arms straight over and get a full extension in the abdominal muscles. You're going to do this again. Walk yourself up. The more you do it, the stronger you'll get. Make sure that you mind your chin and you keep it tucked. Jutting the chin is going to put stress and strain on the discs and the muscles in the neck. You're going to come back up again. You're really going to try to shoot for 15 to 30 of these if you can. Don't be too hard on yourself if you can only get through 5. Just start somewhere and have a goal in mind. You're going to come back up again. So that's one exercise that you can do for the low back. The other exercise that you can do is a standing one. Standing at your desk or standing at your kitchen, you can stand and just put your hands behind your back and extend all the way back. And feel this lower abdominal muscle contracting. Extend back and come up. Extend back and come up. You're going to try to keep your head back, because this is also a great exercise for the neck and reversing the daily activities of living with your head jutted forward due to text neck, taking care of small children, reading a book in bed perhaps. All of these things have a negative effect on the spine. So this is an exercise you can do for the lower abdominal muscles. Extend back and come up. Back and come up. Try that one 15 to 30 times. 3 to 4 times a day. And see if you are not able to begin to start seeing some good six-pack abs starting to form. My name is Dr. Venus Seleme. If you'd like more information, you can go to www.drseleme.com.